Thanks for staying with us on SABC News. There are calls for health facilities to be exempt from the current rolling blackouts that South Africa is experiencing. Since last week, Eskom has been implementing stage 6 rolling blackouts, which means power can be up for up to 4 hours twice a day at least. Dr. Caroline Corbett, who's the president of the South African Society of Anaesthesiologists, joins me now. Thanks so much for your time on SABC News. How would you describe the current state of healthcare in light of those rolling blackouts?
So thanks for having me, Zing. It's a real disaster. In certain areas, we've had to suspend operating procedures altogether because we have, as we know, quite an unequitable health delivery service as it is, and a critically vulnerable health resource. Now, this coupled with rolling blackouts and extensive periods of load shedding, we really are seeing the underbelly of what's left of our health system being attacked again by poor management and poor planning. To a degree, these load shedding crises are not new, and we really would like to see a more active and aggressive approach to sparing hospitals and our critical resources from these outages.
Just talk to us about the effects of those rolling blackouts on different institutions. Earlier on, we had a package on SABC News about an old age home that uses oxygen and that's now suffering because of the blackouts.
Yes, so I think for many of us who are just living at home with blackouts, you might just think of load shedding as not having access to your lights, your television, or cooking and heating. The problem with hospitals is that many people aren't aware that we need cold storage, we need refrigeration for drugs, we need refrigeration even for vaccines. We need to make sure that our mortuary fridges are kept at a constant temperature. We need to make sure our incubators can heat all our tiny little newborns that come through. And the heating and cooling systems are not protected during load shedding and are not necessarily prioritized by emergency backup systems because it's not mandatory necessarily to prioritize heating and cooling. It's more important in certain instances to prioritize electrical supply to ventilators, to oxygen delivery systems, and to anesthetic machines and drug delivery systems. We can't sterilize equipment because the sterilizing machines and basic hygiene within the hospital often requires a consistent power supply, and it's extremely draining on a generator system. The internal and communication systems don't work properly. The record keeping can't necessarily be kept in line. And more importantly, we can't charge our UPS systems for those hospitals that have battery backup. They're not necessarily being able to charge the batteries, as well as the battery backups on critical pieces of equipment like our ventilators, like our anesthetic machines and our incubators. They aren't able to charge in the off time if they don't have stable power.
What interaction have your or other healthcare bodies had with Eskom or government at any level about this crisis?
So we have been lobbying in the media. We have in as early as 2019 and even prior to that. I mean, load shedding has been a reality in South Africa for 10 years plus. So we have engaged with various levels of a healthcare facility to go and firstly on a grassroots level, manage the facility appropriately. So make sure that the budget that's allocated for diesel, generator maintenance, battery servicing, that those things are done on a grassroots level, and then escalating higher to actively say to government, please don't load shed your critical resources, most importantly, your hospitals. So in certain provinces, major facilities are not being load shed, and that's fantastic until level 6 came, and then certain of our facilities were then load shed. So we had excellent interaction with, particularly in the Western Cape. They really listened and they tried to make contingency plans to spare power, to make sure that there was power diversion towards the hospital facilities. And this made a big difference in service delivery. We definitely didn't see the massive crisis because you must remember, we're still trying to recover from COVID. We've still got surgical backlogs and critical care extended backlogs from COVID times. And now we're having to further delay surgery. So Places like the Western Cape where that was happening, that was great. Certain large facilities in Bloemfontein, they are being exempt, but it's the smaller district hospitals, rural facilities, and the smaller facilities that aren't necessarily being remembered in both the health budget as far as making sure that they get access to correct generators and power supplies, diesel supplies. Those ones get forgotten because it's the big facilities that make public news if they're not being serviced appropriately by government. So we're asking government to look at every level of healthcare and realize the overflow of a small facility not being able to deliver services and then overflowing into a bigger facility that is already battling to keep going. If we look at what it costs just to run Charlotte Maxeke on diesel, and that's not even running at full capacity, we're looking in the millions. That comes out of the health budget, which has already been pillaged and is already critically under stress because we just don't have a big enough health budget left to service these kinds of power outages. So it's a multifaceted governmental issue. It's not just about supplying power, it's also about supplying management and management structures that are going to look after those power supplies and start innovating with new and different ways to look at potentially solar power, to look at longer life batteries so that these UPSs can take a better charge than hold that charge. It's everything. We need a big drive towards contingency plans for power, for healthcare. We can't function as a community if we don't have a healthy community.
All right, so Eskom CEO Andre de Ruyter last year spoke about how there was at least 4,000 megawatts missing from the grid, and in the next 5 years, he said last year, South Africans should be prepared to experience load shedding. With this scenario, if around 80% of South Africans rely on the public healthcare system and they're not protected from load shedding in the manner that you've spoken about, inequality is obviously set to grow, which you've also touched on. What's the worst case scenario, and will we experience that worst case scenario if things continue as they are?
I think that it's a devastating thought to think of worse than we're already sitting at, where we can't access basic primary health care in certain instances, let alone a heart transplant or something where we're looking at tertiary or quaternary health care. So I think what we'll start seeing is we'll see a greater exodus of our human resource out of the country, because we must realize that our nurses and our doctors, our porters, our cleaners that arrive at a facility knowing that if the power goes off, a child may die, a baby on a ventilator may die, a person who has just had heart surgery might not be able to be ventilated, that those practitioners take home with them. You can't manually ventilate somebody for hours on end in the hopes that that person will survive long enough for power to come back on. So we'll see human resource deficits greater than what we're already seeing. We're going to see patient loss. And I can't stress that enough. This isn't just about bad service delivery. People are going to die. 80% of our population relies on this service. And even in private healthcare, we see generator and battery backup failure because there's this huge industry push and consumer pull for healthcare that they couldn't access for the last 2 years. So you can't expect people not to go to hospital and expect that they're going to be able to receive healthcare services. We're going to see huge unhappiness from our populations who may not necessarily understand why they can't access healthcare. The knock-on effect into the community is massive. People are going to be sicker for longer, and interventional diseases may not necessarily be able to acquire intervention because the surgery and the healthcare access is just not there, both from a human resource as well as an infrastructural support resource. So we need a plan. We need everybody to pull together as communities, to pull together as industry, and start innovating really constructive approaches as to how do we derive power, how do we have sustainable power, because we can't just keep shouting at Eskom and saying fix the problem. The problem is on so many levels, and there's so many opportunities for industry to collaborate to try and protect this healthcare resource.
Dr. Caroline Corbett, the president of the South African Society of Anaesthesiologists, thanks so much for your time on SABC News this afternoon.